They've been described as 20 of our most vulnerable citizens. The group of residents from a Christchurch Rest Home dementia unit are being transferred to Burwood Hospital after a cluster of Covid-19 cases in their home. Rosewood Rest Home and Hospital in Linwood has 16 confirmed or probable cases of the virus. Canterbury DHB has stepped in to handle the outbreak. More than 40 other residents will remain at the rest home if staffing allows. Canterbury DHB boss David Mates says these people need extra care, explaining what's going on.
A number of patients that were starting to be identified with COVID positive on Friday evening. And to date, there are 16 cases that are either confirmed COVID and or probable in the fact that people have been in close contact with those that have had COVID and have shown symptoms related to that as well.
Where do you think the source is?
It's unclear at the moment, and it's likely that it's been through from staff, but that is part of what we're going through in terms of the contract tracing to confirm where the possible connection has come from.
Just so we're clear, I assume, like many of the rest homes, this rest home was no longer allowing visitors?
That is the case, yes.
Okay, so how many of the residents are ill and where are they at the moment?
So four of the residents are confirmed cases and 8 residents are probable cases. So that's a total of 12, and there are 1 staff member with a confirmed case and 3 staff members are probable cases.
So some people are being moved to Burwood Hospital. Who is going there and why?
So there are 20 residents from the dementia wing at Rosewood that have been shifted to Burwood. The reason for that is the facility that they're in is a very difficult one to be able to isolate and manage a number of individuals that may have or have got COVID, and at the same time being able to keep staff and patients both safe and in appropriate environments. So the reason why we've shifted them to Burwood is that we are able then to provide an appropriate facility and ensure that we have the appropriate staffing levels in place while we work through with the dementia unit in terms of ongoing assessment for its future use.
So in terms of the people who have been transferred to Burwood, do you think those 20 have been exposed to the virus?
So, yes, and as I said, there are 12 of the residents, 4 that are confirmed, and 8 residents that are probable cases. And it is probably fair to assume that the other residents there, out of the 20, have been exposed to and connected with other patients in that wing.
So are you moving, in essence, the people that you think are exposed or infected away from the ones that you think are less likely to have it?
No, so this is a 20-bed dementia unit, and so we're shifting all 20 residents.
What about the balance of residents? Because it is a facility that has, about 65 residents in total, I understand?
Yes, it is. So the other 44 residents, we're working through with teams at the moment just to assess choices and options sitting around their ongoing care. And what we have done to date is put an acting manager in to help us through that process, and we will be reviewing choices and options out over the next 12 to 36 hours. What
does that mean? Do you think you're going to have to split them up and move them?
I think we're working through, again, a range of options. It may be what we're looking to do is, as much as possible, recognising that these are people's homes that we're shifting them out of, and we're very conscious of the fact that this is very, very disruptive to residents. So we've been exploring all potential options and choices where as much as possible to keep people in their own environment. Whether that is going to be possible or not, we won't be in a position to have confirmed that until sometime tomorrow.
So the ones who at the moment are still at Rosewood, do you think some of them have been exposed as well?
No, we don't at this stage, and partly to that is the rest home itself is got a number of wings. The dementia unit is quite separate from the rest of the facility. And so at this particular point, what we've done is work through with the 20 dementia patients that have been exposed or are likely to have been exposed, and to ensure that they are in a safe and appropriate environment to manage their their wellness in the short term.
Do staff move between the two units?
Staff do move between the two units, but there is no indication that, in fact, there is any infection or COVID in the remaining facility.
But it could just be that they're asymptomatic at the moment. If you think it's come from staff members and they move between both facilities, isn't that a risk?
So that is part of the risk assessments we're working through at the moment to be able to make a definitive call on that.
How are the families reacting to this?
Families are reacting really positively, but as you can understand, this is a really, really traumatic time to see loved ones needing to be moved and operated, but all of moved and put into a different environment. So understandably, most of the families have been really, really understanding and pleased that appropriate actions have been taken to keep their loved ones safely managed. But it's always a very trying time for families to suddenly get contacted to say that your loved one is needing to shift and move to an alternative facility.
How many staff at the rest home are taken out of action in essence and have to be in isolation as a consequence of what's happened?
There's a range of staff, again, that we're working through to ensure that they're appropriately self-isolated, and that is part of the process that's been worked through again today. As we have been shifting the 20 residents from the home across to Burwood today, parallel to that is the staff that are going to be in self-isolation for the required 14 days.
How difficult is it explaining to the people from Rosewood, the residents, what is happening and why?
That, as I touched on before, that is always a really challenging part in terms of these individuals, this is their home. And moving anyone out of their home into a different environment is always very, very difficult and very, very challenging for the individuals going into new surroundings. We're very, very conscious of that. And again, what we're looking to is these 20 residents being managed in Burwood over the next 2 to 3 weeks, with the view of how we get them safely back into their own environment.
They would potentially be the most vulnerable people, wouldn't they?
They are potentially the most vulnerable people, and that is why we have moved so quickly to ensure that we've got them into an appropriate environment to manage the outbreak in a way that is in the best interests of patients, the residents, and the staff who are caring for them.
And that is Canterbury DHB boss David Mates.